Good afternoon, everyone. I'd like to welcome you to this event at the European Health Forum Gastein on digital childhoods. We are going to explore if digital health policies are responding to the needs of children and young people, and if they contribute to their health and well-being. We have here with us a fantastic panel that I'd like to introduce to you and that you obviously see. It's Hervé Belani, who is the head of e-health and cybersecurity at the Ministry of Health in Croatia. Welcome, Hervé. It's Barbara Balk, who's the facilitator of Foundation Botnar's Our City initiative in Romania. And I'd also like to mention that this session has been supported by the Botnar Foundation. The foundation has a strong focus on the digital issues and on the health of children and young people and on urbanization. So they bring all this together, and Barbara will help us do that. I'd like to introduce Andre Rees, who is also with us. He's the Director for Health Systems, Medical Products and Innovation at the DG Health and Food Safety at the European Union Commission in Brussels. And I might add, he is a commissioner of the commission that I co-chair on governing health futures, growing up in a digital world. And we are hoping that many of the things that we discuss here today will be helpful for the deliberations of our commission. That is why I also want to really encourage you from the people listening in to use the chat as much as possible, because we are going to use all the chat comments for our work in the commission. Now, I've mentioned that we have this Lancet Commission, and one of the goals of this Lancet Commission is to fully involve young people in that discussion. So we have two young experts, as they tend to be called, with us here on this panel. I'd like to introduce Lucy Fagan, who is with Young Experts Tech for Health, and who's also a global focal point of, now you must help me, Lucy, what is this acronym, UNMGCY?
Yes, UN Major Group for Children and Youth.
Excellent. And in the United Kingdom, and we have Mark Korana with us, who's the co-founder of JOHO, that is a youth health think tank in Denmark. So you can see we're going to have a really great range of input and experience here from government, from the European Union, from a city perspective, and from the youth perspective. And that will allow us to help answer some of the questions that we're hoping to address. Obviously, there's two sides to this digital transformation. One is it opens up enormous opportunities, and all of us are making use of these opportunities, no matter what age we are, and that we're talking like this to each other is one expression of that. But of course, there's also a whole range of risks, and particularly right now in the COVID-19 situation, we have seen that a whole range of these risks are also raising their head again, about surveillance, about tracking people's movement, about being, online too much and all the time, all kinds of mental health impacts and other things. And we hope to explore them with you. Before we go into the panel discussion, we want to have a quick poll first. And I've been told by the organizers that all the participants are very familiar with how this polling goes. And we have a number of questions that we would like you to respond to. So we're asking here, should countries, one, reflect the particular needs and vulnerabilities of children and young people in national digital health strategies? Two, develop separate digital health and youth strategies? C, do both, or do something totally different? And if they should do something totally different, please put your suggestion in the chat box. I'd like to let you know that we will start, according also to the principles of our Lancet Commission, with the voice of young people. We're first going to have what's called a Fireside Chat with Mark and Lucy, and then we will move into the general panel. So the other panelists can now sort of move into the background also with their pictures, and we will have myself, Mark, and Lucy to have a conversation with one another. So you can see here the results we have right now, that there is there's a little support for separate digital health and youth strategies, despite the fact that a number of countries have embarked on exactly that. There is 37% say that the needs and vulnerabilities of children and young people must be reflected in national digital health strategies, but the majority says we actually need both. One can't replace the other. And I think that's probably also some issue that we are going to discuss as we move into the panel. So thank you very much for those answers. And anyone who has some additional suggestions, please put them in the chat so that we can use them for our future analyses. Mark, let's hope Lucy comes back. So let's start with you in this so-called fireside chat. We'd like to ask you, as a younger person compared to us others on the panel, how, from your perspective and from the work you've been doing, in your think tank and with other colleagues, how has the digital transformation affected the health and well-being of children and young people? How would you respond to that question?
Thank you, Ilona. I think really the question is that there are a lot of positives and obviously there are a lot of negatives. And I think there's a lot of potential, but there's also a lot of downsides. Whether one outweighs the other, I'm not entirely sure. But in terms of perhaps the more negative aspects of how it has affected youth and the work we do, I think we're seeing increased rates of anxiety, depression, suicide, which is also related to how youth uses these technologies. There's also the matter of something like sleeping issues. Another interesting proxy is actually that youth are getting driver's licenses later than they usually do, which might be a sign of anxiety. So those are kind of some of the negative mental aspects. From a physical perspective, there's also the fact that we're using more and more, we have more screen time. So the question is that taking away from some of the physical activities that we would otherwise be doing? With regards to the physical aspect, it's a bit hazy in terms of whether the screen time has actually taken away physical time, but overall it does seem to suggest that there might be some negative effects, both on mental health and on physical health. There's also a tremendous amount of opportunity, because we know, for example, for the pediatric population, in terms of mental health services, the outreach and the access simply isn't good enough. And that's where digital health can come in and fill those access gaps that might otherwise be there from a physical proximity perspective. So there are positives and negatives, but I think it's figuring out when to use which tools and in which context tools are more appropriate.
I'm going to challenge you here straight away. If you say one should be doing that, how should one be doing that?
In terms of engaging?
Yeah.
In terms of engaging, I think we need to establish some consultative channels that are consistent. Because once in a while you'll see maybe a youth panel that might appear where it's a few organizations that are working with them. But what we really need is to have something that's more permanent. That when the government, or even if it's larger organizations, when they have issues relating to digital health, that they know exactly how to connect with youth, so it doesn't become a sporadic event but should become something where it's more permanent, where youth can say, oh, I'd like to contribute to this discussion. Where do I go? And at least people or youth should be able to identify where they can go to contribute. Because I think we're all willing. Many of us are willing to contribute. We just lack access, or the forum at least, to discuss a lot of these policy issues and where we feel that we can contribute and change them.
Thank you, Mark. Last question at this stage. Do you think that also should include the voting age? Because here in Switzerland, for example, we have a discussion to actually reduce, in quotes, the voting age to 16 years. Would that also make a difference?
I think it could, because I think we underestimate the responsibility that people are willing to take up. Even in like the old Athens, they used to have citizen assemblies, where they randomly draft in citizens to be part of the parliament. And there they found that people were willing to step up their game and engage even more. So I think absolutely, whether we fall to 17, 16, I think it would have effect, obviously, and I think it would have a positive effect because we get more of those youth voices that we probably do lack in policy.
I mean, from the examples you've given, don't you think there is perhaps something deeper that is happening? Because our lives, and particularly the lives of young people, are also now, both in the real world and in the virtual world. It moves back and forth. Isn't something, much more substantial happening than just saying, okay, here's a few websites and I can chat with my friends and somebody's trying to sell me something, all those kinds of things, and I'm spending too much time online. But is something else happening, how we present ourselves, how we see ourselves, where young people go first, those kinds of things. Could you share something with us on that?
Well, I think you're spot on. I think it's a question of identity as well, and we're redefining who we think we are and who we think other people are. And obviously, that there will always be some type of disconnect, especially in the online world, between what we personally feel, who we represent, and who others are. And it's a classic example of on Instagram, on Snapchat, you only see the positive things that other people are doing. And I think that does play into the anxiety aspect of the mental health issues, because we expect that everything in our life is great, that everyone is always attaining something extra, but it's only because we happen to see those things being posted online. So it's a form of selection bias in terms of what we choose to post, and because we can't manage the level of expectation versus the level of what is actually reality, then we feel that we need to compensate in some way, but we don't need to compensate. But the fact that we feel that we do might be contributing to certainly the mental health aspects, and then almost by extension, because of it could be depression, anxiety, that then affects our physical health as well by increasing inactivity.
So if we go to that second big question that we said we'd like to address in the panel, which is, around the policies, how do you think such digital health policies should reflect the needs of children and young people? What are the areas that, in your mind, are particularly important if digital health policies are taken forward within countries? And, what dimensions should definitely be taken into account?
I think probably one of the most underrated aspects is the idea of ethics and privacy. And I think it's because it's something, when we use technologies as youth as well, it's so natural that we don't think about many of the implications. There was, for example, a case in Denmark where there were almost 1,000 children that were implicated in a circle of sharing images that they shouldn't have done. But it's also because they're not aware of the judicial aspects of it, of the implications. So I think that educational aspect in terms of, okay, what do youth expect? What should they know? And then implementing that from an early stage on. And that's I guess it's somewhat related to health, but even coming back to more health related topics, I think we need to understand how youth interact with digital technologies. And if anything, digital health and the digitalized world is something where youths are almost always in front. They will almost always be ahead of the curve. So that's why it's so important to ask them to have deliberation and figure out, okay, how are they actually using the technologies, so we can tailor it to them. Because the problem is, if we come with a policy that's outdated, then they simply won't use it. But if we're better at communicating in terms of what's hot right now, what's relevant, then I think we'll get a better connection to them. And I think also there's a risk of being too top down in terms of the policies that we create, because it is, ask any teenager and they'll tell you that they're the ones teaching their parents about what they're doing online. So there has to be some type of communication. Otherwise, we'll think we're implementing policy that's relevant for them, but actually it's not relevant at all because we're 3-4 years behind. So I think that's one aspect, the communication that's vital.
Yeah, I'd like to follow up on that, and then I think we've sort of used up our 10 minutes. But we've had some discussions from the Lancet Commission at Wilton Park with policymakers and academics, etc. And one very important point that was made was also around what you indicated around literacy or different types of literacy. But what I thought particularly interesting that this a contributor said, well, we're talking about the health literacy side of things. We're talking about the digital literacy side of things and how they need to come together. But he also said we need to consider the civic literacy type of things. How you behave with each other in the digital world. What are democratic and participatory dimensions? What does anonymity imply? And those kinds of things. What do you think about that, to include that element, and how important do you think it is?
I think it's essential, but I think it goes back to the idea of identity and who we think we are, because suddenly we're having the digital world used to be completely separate, and then we used to have what we considered or perceived to be real life. But more and more, as those kind of have blended, then we're perhaps losing track of who we really are. And I guess that's the evolution of society in general. But then suddenly the distinguishing between real life and the digital world is becoming blurred. And if we're not able to navigate that blur, then aspects of how we interact with each other and behave online will start migrating over into the real world, and we won't be aware that, oh, of course, those have real life consequences. And even on the street, some people have suggested to me as well that the way that people talk to each other has changed. That we're calling people out more. That short bursts of, oh, you're doing this wrong, rather than having a civil conversation. So I think those two have to be, or those three aspects, as you mentioned, have to be considered together. Otherwise, it doesn't construct a comprehensive framework that takes into account all of the dimensions.
Thank you very much for that, Mark. And I think particularly this last comment around, how do you navigate between the real world and the digital world, how behaviors and also how you express emotions, for example, how you handle that, how that influences the real world, how it, spills over back. And that maybe we need, much more thinking about that. And many of these kinds of things, of course, can't be resolved by policies per se, but it's really about thinking, how do we organize our societies? How do we have a conversation between one another and, of course, between generations? And I'm sure we'll come back to some of those issues. One last question with a very short response, please. Would you consider the digital transformation itself a determinant of health?
Definitely. And I don't know how short you want, but I'll just say definitely then.
Okay, and we'll come back to that in the larger panel discussion. Thank you very much, Mark, also for, in a way, standing in for Lucy. Maybe she'll be able to join us on the larger panel. What we will do now is, first of all, ask the other panel members to come back. And Mark, do spend a minute or two looking at the chat. There have been some fantastic comments on what you've been saying, which are really very, very helpful, also for our work in the Commission. What is my task now, before I move on to the panelists, is to ask you again, the audience, to help us define the space in a way that we are discussing. We want to talk about the risks. What are the potential perils and risks of policy for and implementation of digital health, especially for young people as they grow up in this digital age? And what we want you to do is to please identify one risk and share this with us. And we're going to try and, create a word cloud. There are, some examples. You can say, the greatest risk is privacy, is security, is safety, all kinds of issues that are on your mind. So if you could type that in, then it's also an interesting background for our panel discussion, as I ask the panelists to give their own assessment of these risks. Yeah, we can see one of the really, really big concerns that we have in the formulation of, digital policies, and that we see with the digital transformation, that is, the digital divide, the thing that, has come up so strongly. We have exploitation, isolation, bullying, again, access, marketing, isolation, and I think particularly now with COVID-19, that has definitely been an issue that's come to the forefront. The unaccountability of many of the providers and the platforms, I think, is a big issue, but also of individuals if they behave in a certain way in the digital space. Exploitation. So we can see what's on the mind of people. It's interesting that isolation would come up, with such large letters, because when people talk about the digital transformation, they continuously talk about connectivity, and that people actually get more in contact with one another. And here we see that there is, a great concern around isolation, that maybe individuals are alone with their machine or this thingy here, and that isolation is actually reinforced. So we're seeing many of the things that also Mark referred to, the being overwhelmed, wrong view of the world, misinformation, of course, also an issue that's particularly important, not only for young people, but particularly for children and young people as their views are being shaped. So I think, this is a nice background to actually start a discussion with the panel. And I'd like to ask Hervé to start, perhaps, because you are in a Ministry of Health, Hervé, and to what extent are you confronted with these kinds of issues when you are working on policies for e-health and cybersecurity? Do these needs or these concerns of children and young people come into that work? Can you share that with us, please?
Thank you, Ilona. Good afternoon, everybody. Just to be frankly, at the beginning, no, these topics actually do not come up at first when we deal with implementing e-health systems and projects nationwide, such as e-prescription, e-referral, electronic health records, etc. We are aware of the importance of proper digital transformation and user adoption, anyway, in order for systems to fully serve their purpose for the benefits of patients and citizens. So we know that from the policy and implementation level, we actually cannot deny or avoid digital technology usage also in healthcare. If I just talk a bit from that perspective, we see the digital divide also as present, and this one is not so an access issue. It's more a question of it's not just a question of technology availability and affordability, but more of digital literacy and skills. So if I'm talking from the ministry perspective, we do need to work a bit more on digital skills, even for healthcare professionals. We even done the study last year that actually looked at all EU medical schools and actually concluded that about 1/3 of all medical degree curricula offered any kind of health IT course at the graduate level. So two of the thirds didn't. On the other hand, if we look at the recent results of the Eurostat study, the community survey on ICT usage in European households and enterprises, we can see that 4 in 5 young people aged 16 to 24 in the EU had basic or above basic digital skills. So Croatia even had the highest share of individuals in that sense, around 97%. So from the policymaker perspective, we certainly see the need to shift the paradigm and design systems for healthcare to serve and be used by new, well-skilled generations of digital users in the near future.
Thank you, Hervé. But can I ask an additional question? If you mentioned the electronic health records and the accessibility to health professionals, etc. Now, how easy is that for at least young people to access? Or, does this always have to be done in combination with your parents? Can you access a professional digitally if you have, a concern like, pregnancy or something sexual or a mental health issue even that you don't want your parents to know about? Are there regulations around that give children and young people rights of access? Or is there always, parental supervision?
So if we just move away from health for a second and look at the education sector, I think there are decent solutions there that actually regulate the usage of these e-school solutions by students themselves, and the authorization rules, what the student can see, what the parent can see, and how they communicate with the school, etc. In terms of e-health records, we still do have some challenges in that regard, and there is a certain ecosystem of solutions on the national level that has to be set up. For example, for a parent to grant access to their child for certain parts of some systems. So I'm sure that for some systems have to be the other way around. So there is a lot of things to be done yet in that sense.
Thank you, Hervé. Andre, can I move to you, because the European Union is, of course, very much engaged now in the digital transformation. It's one of the big future projects. The Health Directorate is working, on the European health space, on linked also to privacy issues that have always been very central for the European Union in terms of citizens' rights, etc. How is that reflected in your work? The use for children and young people of digital health access, the protection of children and young people from negative impacts on their health. Do you have specific policies? Is it, as we asked earlier, integrated into other policies, or is this a challenge in front of you?
Good afternoon, everybody. Thank you, Ilona, for a question. I think we should start from the kind of statement that to be a child, this is like a moment of our life. We are moving from our childhood to adolescence very quickly, and sometimes, you know, as Honey said, you know, it's very difficult to cut the momentum, you know, from childhood to the adolescence and to the moment that we are 18 years old and independent from in many legal frameworks from our parents, and very easy to take many decisions. So generally, child is somehow run by the same principles, you know, and one of them, and when you studied, is also what we found in our commission. I mean, Lancet commission you are chairing. It's that the benefit, children, they see benefit of technology because they see them also in the context of the cost of different services, access to knowledge, access of services, also affordability. So this is one package of benefit, if I may put under one way. On the other hand, you know, the issues like data security, which already Mark mentioned, or you know, how we use apps, where is the who is investing in all these things, you know, connectivity, communication, learning, you know, all these things are, of course, you know, important for children and adolescents. So we as a commission, of course, we know we have a number of tools we are employing from the EU, helping with all this developments. Of course, you know, in one hand, we are supporting building infrastructure. You know, there are a number of projects and resources allocated, you know, on EU level, but also on member states level to the structure funds to help with the digitalizations and connectivity, which of course, you know, is bringing internet, you know, close to schools, to children, to the teachers, but of course, you know, also to households. The other important, you know, political statement, if you go to the mission letter of our commissioner, Ms. Kyriakides, when he started her working as a commission, you know, in her letter was written, we need to make, I'm just stating, we need to make the most of potential of e-health to provide high quality healthcare and reduce inequality. And I think this is most probably also in the screen when we have seen, you know, this digital divide is a big issue. And of course, you know, as we know, in number of policy areas, health policy inequality is a principle of our thinking, whether it's a cancer or asthma or access to the children care. So I think it's important to keep this both, you know, areas together. I will maybe mention a few more things. I mean, we are coming to the next era of digital health policy in the Union. 2018, we published the first communication in digital health, you know, kind of framing our policy in three pillars: learning, infrastructure across EU, allowing exchange of medical records and patient summary prescription. The second pillar was around data, and the third one was about the digital technology used in the daily kind of healthcare. So all these things continue to be important. Now we are adding one more layer of challenge, which is AI, artificial intelligence, which again is giving now the different type of challenge because of many unknown, which we will face in most probably in the generation of our next generation of our children and grandchildren. So I think it's important area, but today. The main focus is on data, you know, how make data available, you know, to number of first, how to collect them, how to make them available to policymakers, to researchers, to developers of new treatments, medicines, medical devices, and so on. So of course researchers. So we will see this as a big jump in also from legal point of view in coming few months, and this is a target to prepare the new framework regulation in next year. But this year already in few weeks, Commission will propose some kind of framework for governance framework and some principles for so-called European health data spaces, and the health will be separate so-called sectoral regulations coming next year.
Thank you, Andre. And that, of course, relates, if I take the challenge of the Commission, where we say, the decisions taken today on governance are, of course, the decisions that are going to define how children grow up in this world, how protected they are or not.
I think that something which I think is very much, as we discussed also in our Commission, Europe become kind of famous as with the principle of data protection, which in the beginning was seen as Europe is going too far, but now it looks like this concept is already trigger a number of discussion, not in Europe, because in Europe somehow we passed this bridge, but this example is used in the discussion in the US, but also in other parts of the world. So somehow Europe showed that we can try to face difficult problem of privacy, and we have to find for the good solution. And of course, as we learn, at least I am learning to also working in the Commission, that Europe is seen as a GDPR-driven internet, which I found very tricky as a definition.
Yes, and I think that's important as we are discussing this. Obviously, we're at the European Health Forum Gastein, so we have a very European view and discussion on this. Obviously, digital is global, and one of the reasons kids love the internet is because it's global, because you can communicate with people all over the world. Think of TikTok and others. And what we are finding is that for a whole range of geopolitical reasons, of economic tech competition, etc., that actually, as some people are saying, a splinter net is developing where, different rules apply in different parts of the world. And that is something that is going to be of great concern and might actually restrict the access of young people to each other all around the world. Barbara, do you experience some of this? Because obviously Botnar works very globally and is also very concerned about this digital divide issue. And we've seen some pictures that have gone viral on the internet of children sitting in front of McDonald's because there's free Wi-Fi so that they can do their homework. So what are things that in your work you experience, particularly from this more global perspective? Please unmute yourself, Barbara. And while you're doing that, please put questions in the question and answer function so we can pick them up for our discussions, dear audience. So, Barbara, over to you.
Thank you, Ilona, and hello, everybody. I'm very excited, what this panel is bringing to the attention, and broadly what Gastein Forum is bringing to the attention this year, which is really focus of new way of relating to each other and a new kind of partnerships. And I would like to share what you asked me, to bring some perspectives from the urban environments, because urban environments today are really a very vibrant ecosystems. And in particularly, I think that due to the global, as the global economy falls into the recession amidst the COVID-19 pandemic, the role of cities in this world is perhaps even more important to address the citizens' issues. And not to forget that today globally, by 2050, we will have almost 70% of the world population living in urban areas. And if we look at the world as the whole, we know that over 50% of population is below 30 years old. Combining these two, we clearly see the density and the importance of urban ecosystems, how to deal with digital transformation. In Europe, the balance is a little bit different. As we know, the youth percentage is around 1/3. So the major youth drivers are Africa or Asian continents, this is even more expressed. But I would like to share some experience from my work with the Fondation Botnar, where I work as a co-creator of a new global initiative, which is called Our City. This is one of the lead Botnar initiatives, and for those of you who may not know Fondation Botnar, I just want to share that it's the new Swiss foundation, and its focus is really supporting, let's say, emerging solutions for the well-being of young people at the nexus of technology, urban environment, and obviously youth. So as you see, as I described that, we are taking an ecosystem or a system view to these challenges, and this has come as one of the main challenges because currently the way the policies are shaped and the institutions and decision-making is shaped is very much done in particular silos, either generational or sectoral or disciplinary. And we see that with co-creating Our City initiative together with the cities, with the local governments, with public, private, and civic stakeholders, including young people from the start on, this can help rethink how we shape solution, and of course, most importantly, to actually understand different perspective, because perspectives are very different, and very often there is a lack of spaces where these conversations are taking place. And I just want to add also that as we know that while technology or digital technology is transforming the cities substantially, particularly transport and infrastructure, it's quite striking that health and well-being, as well as the environment, in fact, have been lagging behind. And this is a real opportunity working in the city, such as in our example, Cluj-Napoca in Romania, which is one of the European Eye Capitals finalists, recently announced. It was also 2015 Youth Capital in Europe. These are very vibrant environment with this kind of spaces can be created, and the conversations can take place. And what was maybe interesting, you mentioned, and we saw it on the poll, the way we approached working with the city is the first thing we realized that there is really a lack of knowledge what is happening in relation to well-being of young people. And the first thing is we commissioned a study in a consortium of different parts of the university, Babeș-Bolyai University, with civic groups, PONT and Cluj Culture Center, again, to bring the interdisciplinary knowledge to how we view the well-being and digital transformation in the city. And this is just coming to fruition. And I was just looking at the findings, and particularly interesting was it was a participatory study with young people, and the qualitative results, interviewing or engaging through the focus group through different youth groups from 10 to 14 to 17 to 24 years old. It was very interesting to see how they view health and well-being. And they certainly didn't view it just as the absence of the disease, but one of the major issues that came out was, and I will read the words that they were using, that we have to think about internal equilibrium, mental balance, peace of mind, peacefulness, carrying out other activities, home environment, and so on and so forth. And I have to say that this study was done, started in January, so it captured also what has been happening during the COVID pandemic, where, of course, young people mostly stayed at home, and it was really a disturbing, a very challenging environment for them and for everybody to cope with.
Thank you, Barbara. And I'd like to go back to our two youth representatives, if I may, and we'll try again with Lucy. Lucy, you've heard some of the statements here. We've had that word cloud with the digital divide, etc. One word that hasn't really appeared yet is there a divide in terms of gender? Are girls and boys responding differently? Does the digital transformation actually allow girls to participate in the same way, or are structures we have in our society, reflecting themselves again digitally? We're understanding that, with other issues, just like structural racism, etc., also, initially, I remember when the internet was first created, there was this famous cartoon of two dogs sitting next to each other, and one said to the other, "Oh, this is great. On the internet, nobody knows you're a dog." But the fact is that the internet itself does discriminate. Algorithms do discriminate. To what extent are you discussing that in your groups, and what can you share with us about that kind of divide? Please unmute yourself, Lucy.
Hopefully you can hear me okay. Can you hear me?
Go ahead.
Brilliant.
Just about. Just start talking and we'll see.
Let's hope my connection's good enough. So I think this is something that's definitely come up in our discussions. I guess digital transformation holds opportunity to try and transform some of those gender dynamics, but it also plays out a lot of the same gender dynamics and discrimination that we see in young people's day-to-day lives. I think particularly when it comes to things like social media and how young people are interacting in that space, and when we start to talk about mental health, we might say that no one knows who you are on the internet, but actually the way in which young people are engaging in digital spaces is all about expressing their identity, who they are, how they feel, and as a result, they make themselves quite vulnerable. It has positives because they can make other connections with their peers, but particularly I think for young women and girls, it does make them vulnerable. We see a lot of young people actually starting to move away from digital spaces, away from use of social media platforms, because they find that their interactions and what they hope is a space for expression actually can leave them more exposed and more vulnerable. I think digital health holds a lot of opportunities for transforming some of those gender dynamics. We've had some really interesting conversations with young people in the last few months around sexual health. And obviously with COVID-19, we're seeing a lot of clinics and SRHR service provision starting to shut down in countries, harder to access these more in-person clinics. But young women are finding actually they've got a bit more control and a bit more agency in the way that they're able to make choices about their body and what kind of sexual health services that they want to access. So services are becoming increasingly online. There's more opportunity for young women in particular to start looking and interacting in the digital health space, making choices about the information they need, the kind of contraceptives they need to access. And even in countries like India, we're increasingly hearing there is more opportunity to actually access these services online. So I think there are some real opportunities to improve the health of women and girls by giving them choice, by giving them access to non-stigmatizing environments, but at the same time, recognizing that digital space is a very challenging space, and actually a lot of the same inequalities and the same challenges, whether it's racism, whether it's marginalization and access, whether it's gender dynamics, they still play out in the digital world that young people experience, that can have very negative impacts on them as well.
Thank you, Lucy. I'm so glad you're back with us. And I do have to pick up on a comment that is here in the chat, that obviously it's not algorithms that discriminate, but the people who build the algorithms. So that was just shorthand for something. So, you know, technology is always social. Technology always reflects how we organize our societies, how we think, and, you know, how we then have that built into the technology we develop. And but at the same time, you know, each technology bears within it a dynamics for innovation, that because, you know, users are not just passive, they do things. But still, Mark, there's a comment here as well around the commercial dimension of the internet and the social platforms, and of course the algorithms that have been built to explicitly, you know, either exploit or push forward certain types of thinking, etc. How aware are young people of these processes? And, you know, there is a question here asking, you know, how can we make particularly children understand actually the logic, the mechanisms that are at work as they use these digital tools and games and information sources. Can you share something with us on that, Mark?
I think there are more and more that are aware of how things actually work, but it has taken a lot of time. Actually, recently, even on Netflix, there's a documentary called The Social Dilemma, so that which kind of concerns these aspects. So I think people are getting better at explaining what data is being used for, what the kind of commercial model is for a lot of these social media platforms. I think the downside, or the thing that's still lacking, is the fact that youth in that respect are kind of helpless, because they might be aware that this is happening in a certain way, but they're powerless in terms of or maybe feel sometimes powerless in terms of changing it. And it's also a question of what are the alternatives? Because if all your friends are on Facebook, on Instagram, on Snapchat, then it's a question of, okay, do you pull out entirely, knowing that obviously then you're contributing to the downfall of the commercial interests, but then you lose your, you know, that social aspect, or do you keep going knowing that that's what all your friends are using? So I think most people, maybe not most, but a lot of youth are aware of somewhat how it's going on, but I don't think we've reached the stage where there's enough, call it mass protesting, in order to stop. Although we are seeing more and more youth, as Lucy mentioned, that are kind of pulling away from social media as they realize kind of the negative aspects of it and of the commercialization side of it.
Thank you, Mark. I have a question here both to Hervé and to Andre. And you'll remember that, Mark, early on when we had our very intimate fireside chat, said there should be mechanisms for youth involvement as digital policies are developed, either in general or on health. And the question here asks whether, for example, at the country level or at the EU level, you have such structures. If you consult with young people, if you try and hear what suggestions they have, what concerns that they have. Hervé, do you have such structures in your country?
So in terms of the nationwide strategy, there are certain aspects that are being addressed and prepared in terms of national development plan or action plan for addictions. So in part of that, you can find one of the risks that actually we find for potential risk for health and well-being of young children that came up actually high on our radar is a gaming disorder. So we know that it has been defined by WHO in 2018 as a pattern of gaming behavior. And in Croatia, we do have a day hospital in the capital as a part of psychiatric hospital, St. John, that actually deals with internet gaming addictions, especially with youth. And even some numbers say that around 10% inhabitants of Croatia may have some kind of internet addictions. So it is actually considered among top 4 addictions in the country, but it's still a lot of things to be done and investigated in that sense. Just to mention another related fact, there is one big economic ongoing project of gaming industry campus being built along with the faculty and the esports hall in some other parts of Croatia. So of course, if we look at these both facts rationally, there is no sense of stopping children playing games or young people studying to be game developers, or even resist to this very propulsive industry, which will enable economic growth. But what we can do, we can actually, we are aware that the strategies always lag behind from the situation on the field. But what we can do as policymakers and digital health regulators, we actually can recognize the risks and address them specifically, so we can offer digital health guidance, measures, and recommendations, as well as we do for many other public health topics. For example, sexual health, etc. We do have a lot of internet campaigns in Croatia, and campaigns targeted from the public health sector and public health institute to the youth. And of course, surprisingly or not, in order for this approach to anyhow succeed, we will probably have to use, and we are using social media and other digital channels to reach the targeted users.
Thank you, Hervé. And I think you've already made one really important, very concrete point to say that, you know, within a country's public health strategies, these kinds of issues, you know, need to be integrated, need to be a clear dimension. Just as, you know, when we started to include issues like domestic violence and define them as a public health issue, and, you know, a whole range of issues. And you're now saying these kinds of issues that come with the digital transformation need to be defined as public health issues. They need to be looked at by public health agencies. Evidence needs to be collected. Voices need to be listened to. And then public health legislation, or legislation, if we think of health in all policies, in other sectors needs to follow. I think that was, you know, a very helpful and very sort of concrete direction in which we were hoping also we would get some guidance on this panel. Andre, how is it at the European Union? Are you having this kind of dialogue with young people, particularly on digital health?
You know, generally, I don't think we approach, you know, specifically young people. We have a fora, stakeholders fora to work on digital health. One of them is so-called eHealth Stakeholders Group, when we have representatives or everybody, you know, from doctors, industry, and public health associations, and so it's over 50 different interest groups, you know, debating the future of digital health. Of course, you can go across different policies area. For example, in the under the umbrella of employment and labor market, we look for the skills agenda, when digital skills are very important. And of course, you know, many of those skills are born, you know, in the education, in the schools and universities and so on. And of course, we also have in dialogue. We are in dialogue with member states on different curricula development, you know, digitalization of school and the way also infrastructure can be developed, and investment done from different funds. You know, EU is dedicating to digital health. So somehow, you know, digital is a big agenda across policies areas. I don't think we can see health, you know, separated from other policies. I think it's you are most probably the best, you know, to tell us, you know, it was always, you know, both ways. It's not health in policies, but also other policies in health. So I think it's I think Barbara already said, you know, if you are in city government, I used to be, so you really have to work much closer to other departments to get things done. So I think this is what most probably is the best solution. frankly speaking, myself, I don't believe in the kind of only children or young people you speak, because you can easily kind of get old people will speak with old people or children with children, but we really have to see this as a one society. We live in the society. We don't live in the separate group. Children should speak to the grandparents. As a grandparent and as a father, I know this. So I prefer this approach than kind of sector. Maybe one last point, which is also important in our reflection. This is the way internet is used in a number of areas, like advertisement of tobacco or alcohol to children. And here we have some kind of ways to protect, but of course, effectiveness of all these measures is often put in question. So this is other area of the future debate also for parents and public health authorities and digital.
Thank you, and thank you also for that plea for integrating the various discourses that. But maybe it is worth looking at the stakeholder forums that you already have, and maybe there is a youth organization or two that could be added to be part of that larger group. And you've of course indicated that we have to be careful not only about the digital divide, but so many divides are opening up in our society that actually. And partly because of the digital transformation and the way social media work, that's actually one of our democratic challenges, is to bring people together rather than to separate them out.
Isolation was seen as one of the big.
Exactly, and that's where I'd like to go to Mark and Lucy also. How do you respond to what Andre now said? We've said the youth voice does need to get stronger, needs to be involved. Do you have concrete examples where the youth voice really made a difference, and where the dialogue maybe with other groups in society really sort of brought a dynamics and a move forward? Some concrete project, it can be smaller, it can be larger. Would you have an example, Lucy?
So I think on this, maybe just talking a little bit about the Young Experts Tech for Health group. So we're working very closely with the Transform Coalition, the Transform Health Coalition, which is looking at how digital transformation can be leveraged to achieve UHC. And actually over the last year, we've been working together to try and say, what role do young people have in this? About whether it's co-designing, sharing their own lived experience to make sure that the solutions we look at recognize the needs of young people, but also leverages their role as agents for change. And I think where that has come from is really an evolving understanding on both sides that, we can't just have a youth movement for change and a digital health movement for change, but we're partners on this journey. And what that really needs to translate into is, as we move forward and start to think about what this looks like at a national level, how we bring together stakeholders to try and galvanize, to advocate, and to really engage in effective policy change, we need to have young people as part of that broader platform of partners. So how do we build the capacity of young people as individuals to allow them to become more digitally literate, but also understand how it applies to their own lives? How do we build the capacity of youth-led organizations to play an active role in these movements for change, and saying that these are not things that we can all do in a fragmented way, I guess, again, but how can we come together to make a more community-based movement for change? And that involves young people, but that also involves older people, that involves men, it involves women. And actually, we need all those voices around the table to make sure that we have really people-centered solutions. I do think there is a tendency in digital health, and this is maybe where particularly the voices of young people are very important. There's a tendency to design solutions and then try to move young people to that service or that solution and say, okay, we've made it, now you come, and then wonder why young people aren't coming. I do think young people are navigating online spaces in very complex ways, but also the online world is changing really rapidly as well. So what you might be familiar with one year you might be doing something completely different a year from now. And I think embedding young people's lived experiences and their own journeys through online spaces is really important from the beginning of any digital health project that is looking to address the needs of children and young people, because otherwise it is complicated and you don't understand it necessarily looking from the outside, and therefore your solution won't reflect what they really need and how they're going to use it. So I think that's one area particularly where, you know, making sure that involving young people in that process specifically is really important. But then there is a wider call to say young people need to be part of a wider movement for change. How can we empower and support them to play that role?
Thank you, Lucy. And that relates to a comment that was made quite early in this conversation, actually on the chat, where one of the participants said, I guess the query is, what are young people gaining from the digital platforms that they do not get elsewhere? What drives the demand, and how might we supply a better solution to what's currently available? And that at the same time affords greater protection of rights, privacy, etc., etc. So that was a comment quite early on the chat function that picks up on some of the issues that you've said. Mark, how would you respond? And maybe also if you have a concrete example of, you know, working together and trying to move the agenda forward.
I think I have a few concrete examples. I mean, earlier in the year, in Johor, we created a report looking at what are the kind of consultative channels that exist at the moment at a European level. In Europe, we have the European Health Parliament, which was launched in 2014 by the European Commission, and there they meet a few times a year, and then they come up with concrete proposals. And I know in 2015 and 2017, some of the proposals that were made at the final assembly in the Youth Health Parliament actually made it into some legislation. So that's, I guess, one concrete example where there are some youth that are sitting together thinking about health, where it has actually resulted in legislative change. In Canada, you have the Prime Minister's Youth Council as well that has something similar. In Norway, they have a youth panel as well that they consult. The same in Australia, they have one in Africa as well. So there are some examples of where youths are involved in kind of legislative process. Although within digital health, I don't think we've gotten to that stage yet, where there are great examples of where youth are participating in that way. So those are some concrete ones. With regards to the commercial side, it's difficult because I'm not sure we're competing with Facebook and Instagram and Snapchat. I don't think perhaps that's the goal. As the question might have been framed, but it's really figuring out how we use it properly. So we're not out competing them for a dopamine rush as such, but we're figuring out, okay, when is the dopamine rush of getting likes necessary? I think that's where the question lies.
Barbara, from your side, what are concrete examples that you find are making a difference at city level, bringing together young people, digital, urban change? Do you have any concrete examples? Please unmute yourself. Thank you.
Yes, thank you for this question. It is clear that cities are emerging as living examples of how to co-design and cultivate a more inclusive social innovation ecosystem. However, and I will give examples from Cluj-Napoca, where we have worked extensively, and there is another city where we have been working extensively, which is in Tanzania, Tanga in Tanzania. So our Cluj and our Tanga are such examples that where we have hope or we have been creating spaces where different stakeholders and different youth groups can meet and discuss the focused area. And as a result, for example, in Cluj-Napoca, we came to the conclusion that health was far really high up, not health as a medical health, but well-being of young people that came from all stakeholders, that this has not been addressed at the city strategy. The city has an in-depth strategy. However, well-being in general has not been addressed, and certainly not from the aspect of young people. And we, through this process, the multi-stakeholder process over now in the second year, we are making a good step towards the integration of this finding into the city strategy. Obviously, this is a long process, inclusive process, where a number of decision makers from across, the local government, diverse academic experts, diverse groups, in Cluj in particular, 1/3 of population is student population. Students are extremely well organized. There is over 100 various youth groups that come together, in the association. Also, the high schools are quite organized. So it's this quite extraordinary, vibrant ecosystem, not seen in every city, but they, I would say, what we could help working with them is enable and empower them and host spaces where they can meet decision makers, which would be otherwise very challenging to do, or it would be more, I would say, more or less tokenistic. But I think it goes both ways. Also, when in cities such as Cluj, there is a development of a youth strategy, for example, it's also important that young people themselves reach out and bring in other stakeholders from other areas, like a digital health, to really, bring this, not create another isolated strategy, but really come together and have a dialogue how these processes could perhaps be reimagined based on the existing stakeholder and spaces, how the new bridges can be built, and have a very specific goals that are relevant for the city context. In the city of Cluj, a specific goal that came really on top was specifically profoundly expressed, the insufficient, ineffective health promotion, health education, and anything disease prevention, in addition to, in general, education system. And they are working, one with each other very, very closely, because there is a clear lack of not only health literacy, digital literacy, but also, like you, Ilona, mentioned at the beginning, civic literacy, to empower. How do you actually work with others? We are all just humans, doesn't matter generation or sector. How do we shift that? How do we educate and empower young people as well as adults, that we need to rethink how we lead the processes and design strategies and policies.
Thank you, Barbara. And you and Andre have, of course, highlighted, how many policy areas and arenas are affected. That, the digital transformation obviously impacts on the whole of society. There's challenges in the education system, in workplaces. There needs to be Hervé mentioned that earlier, a rethinking of health professionals. There's a question of new occupations. There's, so many issues where all of this comes together, and our societies are basically redefined, and our health systems are redefined. And what Andre related to was, increasingly they are data driven. And the question that one also needs to ask, where do these new technologies, these new approaches actually help us improve health and well-being and create a better society? Or where might they actually even hinder it, or reinforce existing divides, as we've heard? As we come nearer to the end, I'd like to ask each and every one of you in to share with us maybe one or two very, very concrete projects that have been developed that you feel might have, maybe they've even been studied, that have contributed to increased health and well-being of young people. Hervé, can you share something with us from Croatia, maybe a very concrete project? Barbara, can you mute yourself again? I think you're bringing some noise in here. Thank you.
Yes, thank you, Ilona. On this question, I would like to mention one series of projects that actually resulted in the national level competence network. So it regards of ICT-based augmentative and alternative communication. So basically, it's developing apps and solutions for Croatian market to make children's well-being, to communicate via these apps, so especially children with development difficulties, such as Down syndrome children. So there has been an ICT competence network for innovation services for persons with complex communication needs established, and actually it consists of multidisciplinary work of academia, SMEs, NGOs, and I think the policymakers have to make some stronger inclusion in this initiative. So basically what they do in a systematic way, they deliver inclusive, adaptable, and localized solutions and apps for smartphones and tablets and other tangible devices for the benefit of their sensitive user groups. So we are talking about the people with complex communication needs who cannot communicate via standard way, but we have to augment. Lucy already mentioned the need to augment with symbols, different aids and techniques and strategies. So in order to properly design such apps that support young users with complex communication needs in their everyday life, so from school engagement to personal settings, we have to learn from various fields, from education, from psychological and rehabilitation fields that already are deeply involved in life care for these people. And we really see this kind of competence network that is multidisciplinary as a positive example how digital solutions can contribute to the well-being of certain group, of certain target group or groups of people.
Thank you very much, Hervé. Mark, any concrete project you'd like to share with us that's really made a difference for young people?
Well, I think I have a couple of clinical kind of related ones. Perhaps slightly different. There was a study earlier this year looking at ADHD patients, or the pediatric population, and there's a kind of video game interface called AKLTO1, where children play for 25 minutes a day, 5 times a week, and then they do it for 4 weeks, and they found that they could actually improve attention among these pediatric populations, which otherwise is very difficult. Another example is in sleep apnea for younger patients. It's a clinical issue where adherence is low in terms of the devices that you use to kind of counteract this sleep apnea. But then there's a study looking at, okay, what if we use a device to track this adherence? Then they also found some positive improvements in how much they would adhere to these treatments. So those are kind of two clinical, I guess, one mental, one physical example of how digital technologies have helped particularly pediatric populations.
Thank you, Mark. Andre, from your side. I'm sorry, I'm losing my voice.
As a part of promotion, I think we can show the example of European referral networks, and they are dedicated mainly to the rare diseases, including rare cancers. And you can see, that how you can use the potential of expertise across Europe, from all countries, and is also a way to share knowledge, decrease the inequalities, and increase access to the best possible expertise for children and for pediatricians or those patients or parents they need help. And many of those, of course, are dedicated to having children as a patient. So I think it's a great example of the European project, which benefit not just member states but also individual country. Not our moderator disappeared. So
no, I'm here. I just need to blow my nose. And
okay, so you blow nose, Barbara, you can continue.
Thank you very much. Barbara, a concrete project from your side.
Yes, I'm very glad to share the two projects that we have been supporting. One is focused, but maybe before going to the project, I would say why this project, because we try to shy away from project-based approach, but really think about ecosystem approach. So when we look at the ecosystem of the city, we identify a challenge. In this case was childhood obesity. And as part of that, we supported the initiative, Velo initiative, that uses digital technology to engage young people, but also parents and families, on the long-term way to inform about healthy habits and hopefully longer-term change the behaviors. But it's not enough to focus on just the project. So what we are focusing on is identifying other initiatives that can build on and add complementary to these projects and others that we are identifying to begin tackling this childhood obesity, because we know childhood obesity is a highly complex societal issues, often based on the inequality and diversity of the income. So we're really taking a more long-term approach. How can we bundle, so to say, a number of initiatives and help facilitate and continue creating the spaces where they can come together towards the collective impact? The similar example, different area, but very similar approach. Education came out as a major challenge in the city metropolitan area. And we identified a brilliant initiative using artificial intelligence. It's called Edu Alert, that focuses on school dropout in Romania in general, but in many places around the world, especially now because of the COVID crisis. The school dropout are a serious challenge, and this is a fantastic way, through the artificial intelligence to actually, instead of doing that linearly and retroactively, you actually have a live data and warnings, early warning system where there are possibilities for school dropout, so you can address that. And obviously, long term, this impacts substantially on the well-being of young people and the whole of society. And again, not looking at the project in isolation, working very closely with the school inspectorate of the county, with the other schools, helping how this can add to other initiatives, linking together to the education cluster that is being established in the city that brings together academia, different high schools, the whole school ecosystem, together with the city governments and young group and civic groups that have been instrumental in fostering education to hopefully over the long term, we can create, I would say, more of a systemic impact addressing these challenges.
Thank you, Barbara. And we're close to the end, and we'll give Lucy the last word. I just want to highlight one comment that we had here from Canada, and that is to actually not forget that there, are many, many different kinds of long-standing youth projects out there, and that linking up to them here, is the reference to life skills projects for youth, health literacy projects, career and life management support, so that, we really keep in mind that we don't need to build, a whole stream of separate new digital health stuff, but actually for young people, but actually try and be integrative in that way as well. So can I ask Lucy one concrete project that'll let us leave this conversation in great optimism?
Great. So actually, I want to pivot off that last comment, which is that I think, there are a lot of really exciting emerging initiatives, but there are also just some very good ones that are already out there. So I want to talk about an example which is from Australia. It's called Reach Out, and it's a youth mental health forum. It's existed for over 20 years, so it's evolved with the digital technologies and with the times. But the core idea behind it is it uses and builds the capacity of a number of young people aged under 25 to become youth forum moderators to help them respond to concerning posts and to support users. And they've also worked now to try and train up an AI that tries to identify posts that might indicate that a user is either in severe mental distress, self-harming, or potentially at risk to life. So using some, quite expressive language, quite emotive language that might raise concerns. And it's really well used. So it receives around, I think, about 150,000 visits a month from young people and their parents. So it's a place where young people are going. It's tapping into the power of young people to actually become sort of active partners in making sure that this program is a success. And I think the fact that it's been around a long time just shows actually sometimes quite simple ideas have, a lot of sustainability and can really deliver for young people.
Thank you, Lucy. And I think that's, a wonderful message to end our conversation with. On the one hand, we're confronted with a big new societal change. We're confronted with new technology. The solutions to our problems don't necessarily lie in this technology. There have been programs for a long time who've tried to address, a number of complex social issues that stand in the way of health and well-being, a whole range of social determinants of health and others. Yet at the same time, we know that one of our responsibilities, and I come back to Hervé's earlier point, of integrating this into public health strategies, one of our responsibilities is really protection also of children and young people. And it's, as the new public health says, it's about empowerment of children and young people. And therefore, bringing those two together will be a very, very important challenge, because you can also be too pater or maternalistic in approaching things. At the same time, you have to be able to bring in innovation and the voice of young people themselves. So I'd like to say a big thank you to all the panelists. I think we heard a lot of very stimulating thinking. We heard about some very concrete projects. We heard about some challenges. We heard some parts to possible solutions, how we must continue to address the problem. I think we identified the problem also, that in moving forward in regulation and policies for a digital and data-driven world, we do need to keep these elements into account. And we, in general, need to be more inclusive in policy making. And also, as Andre called us, to be universalistic. We don't want new divides in society. We actually want to bring them together. And one of the experiences, particularly over the last years, has been that the digital transformation has in some cases, led to greater connectivity, but in other cases to greater divides. And that's why I think, this combination of digital literacy, health literacy, and civic literacy is going to be ever more important in how we structure our societies. So thank you very, very much. Thank you to everyone who helped prepare this, particularly Michaela Neumann and my team, and the wonderful team of Gastein that has made this possible. And thank you again to the Botnar Foundation for supporting this panel. I hope the participants gained something from it. And we will, of course, analyze the chat. And if there's anything you want to share with us, go to our website of the Lancet Financial Times Commission on Governing Health Futures. And we're very, very interested in your comments. So thank you very much. Thank you for your contributions, and see you again in this space somewhere. Okay, bye-bye.